This is a Blend Extra. For some people, psoriasis is just a nuisance, but for others, it can be a painful and debilitating disease, especially when it's associated with arthritis. August is Psoriasis Awareness Month, and Dr. Eric Alexander is here from Dermatology Associates of Wisconsin to tell us more about it. Thanks for being here, Doctor.
Thanks for having me.
All right, I think this is a condition that's gotten a lot of play lately in commercials and media. What is psoriasis exactly?
So psoriasis at its heart is a problem with the immune system. And your immune system, which normally is protecting you from all sorts of infections and germs, goes a little haywire and instead basically decides to attack your skin. The manifestation of this is usually elevated, red, scaly, itchy plaques, often in characteristic areas, elbows, knees, lower back, and scalp, but really can affect anywhere on the body.
Okay, so people who have psoriasis, are they at risk for other diseases as well?
Absolutely. So the thing that we see most easily is the rash on the skin, and that can have all sorts of problems symptomatically as well as just the visual appearance. But as you mentioned, goes along with arthritis in up to 30% of people. We also know that people with psoriasis are at increased risk of depression, alcoholism, heart disease, heart attacks, diabetes, obesity. So it really kind of helps us to look holistically at people with psoriasis.
What causes it?
So we don't know exactly what the cause is. In a lot of people, there's a genetic component, not necessarily one person in the family, but a complex combination of genes. There are probably also some environmental triggers, but that's still an area of research. What we know is sort of what's going on at that microscopic cellular level and that sort of bad inflammation in the skin that produces the symptoms.
So are there different types that people can suffer from?
Absolutely. So, you know, I talked about the plaques that people get. That's what we call your typical plaque-type psoriasis, which is the most common type, but people can get it in odd locations such as the body folds, under the arms, and the groin can have a slightly different appearance. Some people will get what we call guttate psoriasis, which are very small little spots of psoriasis, often in children, often has a much better course. And some people are even covered head to toe in this. A bad form we call erythrodermic psoriasis. That often requires very aggressive treatment.
So you're saying the second type that you mentioned, which I haven't heard about before too, oftentimes in the folds and such, could people confuse that with just a sweat rash, or is that the same thing?
Absolutely. It's different from just your typical kind of heat rash, and it often is misdiagnosed at first because it doesn't have that typical appearance of what we think of those large scaly plaques of psoriasis. It's often more flat, much more red and shiny rather than sort of dull and scaly.
So someone who's listening to this saying, it sounds like I may have psoriasis, what exactly do they do to treat it? Can it go away?
So we don't have a cure for psoriasis, which is one of the important things people need to realize, but that doesn't mean we don't have good treatments to help minimize this and keep it under control. For people with very limited disease, we can often do quite a bit with creams and ointments that we put on the skin. When things get more advanced, we have a medical type of light treatment that often works out very well and is a very safe type of treatment. And then for the more severe cases, or when other treatments aren't working, we go to medications that have potentially more side effects but are also very powerful. Pills and some injections that can really help quiet it down and can really be life-changing for a lot of people.
And if you see someone or you know someone, it's not contagious, correct? This is something that's truly just affecting them in their immune system.
And that's absolutely correct. And that's one of the problems that people run into, especially when it affects cosmetically sensitive areas like the hands. You go to shake someone's hand, they don't know you have psoriasis, and that can be very debilitating.
If you or someone you love may be suffering from psoriasis, you can contact Dermatology Associates at the phone number on your screen. It's 855-DERM-WIS.